We are at the Royal Society of Arts, and the Institute of Global Health Innovation is hosting a major summit. It's a joint summit between the Institute and NHS England, where we're debating the future of the National Reporting and Learning System. May I welcome you on this important day for us. You know, we're really depending, by the end of the day, we will be at least wiser in directing this very important piece of work.
We have to work out how to deal with the problem of not being able to learn as much as we'd like to because of the logistics of dealing with such a large data set. So scale of harm, big, systems thinking, part of the solution.
I think the central question that we grapple with in the development of the NRLS, which I'll talk through right now, is the potential of the current system as well as the community and the culture that sustain it. We can solicit expertise from other industries and other countries who have experience in incident reporting, and we can mine the existing data to see what insights we can draw out of it. What we'll do in the next session is share much of this information with you, and then we'll come back to this third phase, envisioning a future system, to hear some of your reactions and some of your perspectives.
We've had a system which is more than 10 years old. The Institute has been leading a major initiative of reforming the system. We have different stakeholders at this important forum with backgrounds of NHS. They could be clinicians, they could be administrators, payers, providers who really have interest in patient safety.
Do I lose everything? Is there ability to save? How? Yeah,
it's really interesting reading your preliminary results and some.
Speedily.
Yes, clinicians can give you the history of it and what happened.
All the stakeholders here are engaged in a number of interactive sessions, and at these sessions we're capturing some new ideas, they're validating some of the work we've already done, and really designing the future system of the NRLS.
Improving.
Again, the local reporting is tremendously important, but and that, if anything, needs beefing up and better documentation and more open disclosure, more discussion as well, which should be done on a day-to-day basis, and we'd all expect that in our relative.
I don't think we need to just be looking at what can be done from the centre. I think it's a responsibility throughout the system to look at this data and to work with it and use it for the right purposes and for improvement.
Whoever has access to the data needs to have a mandate to use it in a particular way rather than to use it in a punitive way. And I'm not suggesting for 1 minute that's how you would use it, but
absolutely not.
Yeah.
Patient safety is one of your top priorities nationally. You need to put some resource to it. Easy said.
We are turning now to the panel portion.
I think you need the right sort of information coming to you systemically. It's the aggregation to provide insight.
We need to assess quality, and then we need to do something to improve it.
The other element of collaboration is that it has to be longer lasting than those in the past. What is it we know that can fix a problem, that there are solutions somewhere in the world, someone has identified this and have worked on solutions?
You need to achieve change largely through people routes.
The whole day is designed about listening for new ideas, learning from other people, learning from other systems. The more complicated healthcare systems become, the more safety becomes a challenge. Now we need to decide, what have we learned for the last 10 years? What works, what doesn't work? How do we improve the system in which the learning from these reports will have an impact on patient safety?